Let's go straight to Vanessa in Cheshire on the line. Hello there. Thanks for ringing. What's going on with you? You're on to Dr. Philippa.
Yes, thank you very much. Hi, Vanessa.
Hi.
Hello, Dr. Philippa. Yes, basically my question is in regard to the fact that both my parents died of cancer, both within 8 weeks of diagnosis.
Oh, dear.
So obviously it was extremely, traumatic, as it is, of course, for anybody that's, experienced it. Now, the thing is that I have raised inflammatory markers, and I know that, of course, inflammation can be a precursor to getting cancer, and it's been going on now for about 3 years. So each time I've had the blood tests, they've been they have been elevated. So I just wondered if there was anything that I could actually do, because at the moment I'm feeling as if I'm on a ticking time bomb. Right. Is there anything that I can actually do to kind of bring those markers down?
So first of all, I have to say, I love being on this show. It's like being in medical finals every time. You don't know what's going to come. No. You don't know what's going to come.
Just to say, if you're on This Morning or any of those other shows, there's warning. On this show, there's no warning. This is proper. No, this is the truth. I'm telling the truth. Otherwise, I'm not going to be here if I don't tell the truth. This is not like most shows. This is properly live, and Dr. Philippa really doesn't know what you're going to ask her. There's no preparation at all. So go for it.
Right. So inflammatory markers they are blood markers, and they can be raised for lots of different reasons, including things like rheumatoid arthritis. So it can be raised in infection, and it can be raised in inflammation. And so there are lots of different causes, and there are lots of other tests that we would then do to try and work out why are yours up. So it might be up if you have the flu, and then it might be up if you've got various other conditions. I think, though, that when you know you've got a very strong family history, the first thing is that you must talk to your doctor about it. There are some things which might be genetic. There are some extra screening programs that we might ask you to do. But there are things that all of us can do to decrease our cancer risk. And we should all be doing those. And some of them are obvious and they're not sexy and exciting, but they are true. So not smoking, not drinking alcohol, exercise, trying to maintain a healthy weight. And irrespective of our family history, those are things that we should all be doing, exercising regularly and things like that. But if you are concerned and your markers are consistently raised, we need to find out why. And I would go back to your doctor, and that would be the question that I would be asking.
All right, very good luck with that, Vanessa. Thanks so much for ringing. Vicky's on the line in London. Hi, Vicky. What's going on? This is an HRT question. Oh, good. Nice and relevant. We love that one. Go on. What would you like to know?
Oh, hello, everyone.
Hi.
Yeah, I just want to know, I'm 64 and I've got severe osteoporosis, and I didn't take HRT when I had a menopause at 43. And I don't want to take bone drugs. And I was told by a gynecologist who I saw for a different reason that there would be no contraindication for me to take like the lowest form patches and progestin, like as a pill or a coil. And she said, your doctor will your GP will, sort it out, see your GP about it. But my GP is refusing. So I just want to know if there is a cut-off point because of my age, and if there are still risks, because I know years ago there was...
All right, Vicky, let's give Philippa a chance to answer. Dr. Philippa, what do you think?
Okay.
So I think this raises a couple of things. First is that you had an early menopause. You were under the age of 45. A premature menopause is under the age of 40. And for women in that position, they have more years not being exposed to estrogen, which protects your bones and your heart. And so for people who do go through an early menopause, it's really important that if you can go on HRT, not everybody can, that would you do that. Generally, we say that the safest time to start HRT is within 10 years of the menopause. But HRT is a treatment for osteoporosis. And if you're in a position ever where your doctor is saying one thing and then another doctor is saying another thing, the question is, please can you liaise with each other? Why won't you give it to me? What else do you know about me that perhaps that first doctor doesn't? Because generally it is often given as a treatment for osteoporosis. And so I would go back and I would ask why, and perhaps they can do something which we call advice and guidance, which is when your NHS GP can fill out a particular form or email without having to wait for the long waiting list to see the doctor in hospital and say, I don't know what to do in this situation, what do you think?
OK, Vicky, try that. Let's go to Pam in Merseyside. Pam, what's going on with you? This is a lump on your neck, I believe.
It's a lump in the neck.
In the neck? Gosh.
Yeah.
OK, Dr. Philippa.
Tell me a little bit more about that.
I thought it was glands, but it seems to be... You know when a balloon goes down and it goes all squishy?
Yes.
Well, that's what it feels like inside the neck on the right-hand side.
And does it affect your swallowing at all? So perhaps
No.
if you're eating something crunchy, that makes you cough?
No.
OK, so the neck is a really complicated structure. There's a lot of stuff going on in there. And yes, it can be related to lymph nodes. It might be related to your thyroid, which is a big gland that sits in the middle of the neck. And you can get nodules on that. You can get overgrowths on that. It can be related. You can have a cyst that's there. There are absolutely lots of things that are going on in your neck. And I would recommend this is one. You need to go to your doctor. Your doctor needs to take a proper history from you, examine the neck, perhaps take some thyroid function tests and find out what's going on. But anybody who thinks, oh, hang on, she just mentioned swelling in the neck and perhaps difficulty swallowing. Difficulty swallowing is something you absolutely need to see the doctor about.
OK, I just want to ask Pam a question if she's still there. Why haven't you been to the doctor yet, Pam? Is it because you can't get an appointment or because you're scared to go or what?
Well, we do have a long waiting list, but yes, I am a bit concerned in case it's cancerous or something like that.
And that's a really common worry, isn't it? I'm worried there's going to be something nasty, so I'm not going to go.
Yes.
But any lump in the neck that's been there for 3 weeks or more, that's our cut-off, you have to come and see us. Cancer that is found early is much more likely to be treatable. So we want to find these things early.
So, Pam,
and I'm not saying
if it's been there for more than 3 weeks, when you phone to try to get the appointment, say that. Say,
yes.
Yeah, say, I've had this lump in my neck for more than 3 weeks. I really do need an appointment. Please don't tell me I can come, in a 3 months' time. I need to come now. Listen, lots of luck with it. Do let us know how it goes, please, because I'll be thinking about you. Tony's written to us on WhatsApp and he says, I have constant tingling in my feet and in my right hand. What do you think that could be?
Again, we start off with so many things that we then have to narrow down. But perhaps what we're describing here is what is known in medicine as glove and stocking loss.
Never heard of that in my life. Have you?
That is...
Panel look absolutely bewildered. I literally glove and stocking loss.
Glove and
never
stocking
heard
loss.
Of it.
So if you imagine...
Housemaid's knee, we know. Tennis
yes.
elbow.
Yes.
Glove and stocking loss, I never heard. What the heck is that?
So that is something which sometimes happens with diabetes, and it is to do with neuropathy, which is damage to the nerves, and that can present with numbness, but it can also present with pins and needles. So if somebody comes in and they say specifically just one part of the hand, perhaps these 3 fingers or those 2 fingers, I'm already thinking, which nerve could it be? Right. But when we are talking about both feet, one hand, maybe the other hand, I'm beginning to think glove and stocking loss. But it could also be related to low levels of vitamin B12. So perhaps if you are a vegan, that can be something that happens. So if you have...
Wait. If you're a vegan, you might be deficient in vitamin B12?
Not always, but it is
might.
something that we think of, and often people who are vegans will take a B12 supplement or might be recommended to do so if something comes up in your blood work. But if you're having persistent tingling, that's your nervous system. We need to know what's going on. That would absolutely prompt me to not only examine you, but do some blood tests as well.
Really? And just checking, glove and stocking syndrome, is that always something to do with diabetes, or is that something? Can it be something else?
So it's called the glove and stocking loss, is the distribution of the nerve potential symptom, and it can be related to other things, but it often is related to the nerve damage of diabetes.
Cripes. Anything you quickly want to run by Dr. Philippa? How are you feeling, you three? You look reasonably healthy. I don't know.
I've learned so much.
Yeah, me too. Any symptoms you need to cough up while she's here quickly? Anything
Not really.
Nothing wrong with you?
Well, I'm just wondering whether my foot's tingling.
And Dr. Philippa, this notion of people not being able to see their GP, this is very, very serious. I mean, we're obviously having a lovely time, but it isn't lovely when you're worried. You can be worried about your baby, you can be worried about yourself, you can be thinking, oh my gosh, I've got a lump in my neck. Could it be very, very serious? I'm a bit scared to go. All those things that you think every time you want to see your doctor, and then you ring and you can't get through, or you ring and you can't get an appointment for ages. People are really feeling this very, very deeply, aren't they?
So I think there there are a number of things that we need to be clear about. The first is that your GP receptionist is not the dragon that everybody thinks she is. What she's trying to do, or he, is get you to the right place. So when they ask you, what is it about? It's because, for example, I can't do joint injections. There's no point coming to me for joint injections. You need to go to my colleague down the corridor. We're trying to put you with the right doctor, or can you be seen by the nurse or the physician's associate or whoever else that it may be, who can go and actually talk to your pharmacist, because, for example, if you have shingles or various other complaints, you might be better off dealing with your pharmacist. And so it's important that we're all using the resources out there appropriately, but there is always a duty doctor on. And there is always somebody who will be dealing with emergencies. And lots of practices have lots of different ways of accessing us, be it the phone call or turning up or an e-consult, or that we're responding to you by text message. We are trying our best to, and it's as frustrating for us as well.
We know you're trying your best. Let's go to Deborah in Kent. She's on the line. Hi, Deborah. It's your leg that's hurting.
Yes, it is, Vanessa. Thank you. Your show's lovely. I suffer with osteoporosis, and I've had a pain in my leg for a couple of weeks now. It started in my ankle, and it's up my leg now. I just wondered if it was related to that.
So osteoporosis is a condition where the bones become very thin and more brittle, and they're more likely to break. And sometimes that can even happen if there hasn't been a real injury, a real fall. So I don't know if it's related to that, but there are lots of things that it can be related to. And when we think about joints, we actually think about the joint above and the joint below. So if you say to me, my knee hurts, I will be thinking anything from your ankle all the way up to your hip. So you're saying it started in your ankle, and I'm going to think, well, it might be her ankle, but it might be related to your foot, and it might be related to your knee. And we need to examine and see. But there are things that you can do in the meantime. So, for example, ice. We have ice, in your freezer. A pack of frozen peas, tea towel underneath is a brilliant, not just pain reliever, but brings down inflammation. And if you've got inflammation in the joints, that can help. You can buy a non-steroidal anti-inflammatory gel over the counter, and rubbing that in can deliver pain relief and some help as well. Always check with your chemist before you use something over the counter that it doesn't interact with something else. There are lots of stretches and things that you can get just looking on the NHS website. So do stuff for yourself, and if it's not working, absolutely go see your GP.
Deborah, hope it works out for you. Thank you very much indeed.